Good morning, evening, or afternoon, everyone, depending on where you are at in the world today. My name is Shelby Johnson. I'm from the Mid-America Mental Health Technology Transfer Center, and I just want to thank you for joining us today. First things first, today we are using the Zoom webinar platform, so all attendees are automatically muted and you won't have camera access. Also, today's session is being recorded, so you will have access to this at a later time. Two features that we're going to be using today in this webinar platform are the chat feature and the Q&A feature. We ask that if you have a question you would like answered, you put that into the Q&A, but if you would like to chat with our other attendees or panelists, or you have a link you would like to share, please utilize the chat function for that. Next slide, please. Today's session is titled Student Mental Health During COVID-19, How to Prepare as Schools Reopen, and it's brought to you today by the MHTTC Network, University of Nebraska Medical Center, the United States Public Health Service, SAMHSA, and the National Center for School Mental Health. Next slide, please. Today we do have two presenters that we'll introduce a bit later. Next slide, please. Our housekeeping items, we have made every attempt today to make this connection as secure as possible, but if for any reason we do have to close down the webinar, we will reach out to you via email using the email you used to register for this session. To reiterate, all attendees, you are muted and you do not have camera access. If you have a question for our presenters, please go ahead and put that in the Q&A box. But if you have a comment or a link for all of the attendees, please use the chat function. At the end of today's session, we will have a link and a QR code available for a survey we'd like you to complete. And you will receive an email next week that details the information about your certificate of attendance. Next slide, please. The MHTTC network, it's our mission to accelerate the adoption and implementation of mental health related evidence-based practices across the nation. And we do have 10 regional centers, as well as a National American Indian and Alaska Native Center, a National Hispanic and Latino Center, and a network coordinating office. Next slide, please. Today's presentation is being brought to you by two of our MHTTC centers. That's going to be our National Coordinating Office there on the left in California, and Region 7, the Mid-America MHTTC, right in the center of the country. Next slide, please. And this is our disclaimer. We do ask that you share this webinar with your colleagues, but please do not duplicate or distribute this presentation for a fee without specific written authorization from the MHTTC Network Coordinating Office. And also, these opinions expressed today are the views of our speakers and do not reflect the official position of the Department of Health and Human Services or SAMHSA. Next slide, please. Again, today's presentation is titled Student Mental Health During COVID-19, How to Prepare as Schools Reopen, and it's brought to you by Drs. Brandy Clark and Dr. Nancy Lever. Next slide, please. Dr. Brandy Clark is the Project Director for the Mid-America Mental Health Technology Transfer Center. Dr. Clark is also a licensed psychologist and an associate professor in the Department of Psychology at the Monroe Meyer Institute for Genetics and Rehabilitation at the University of Nebraska Medical Center. She has years of experience in clinical training and research related to increasing access to mental and behavioral health supports for children and adolescents in various settings, such as schools and integrated primary care. Dr. Nancy Lever is a clinical psychologist with extensive clinical research, policy, and training experience related to advancing comprehensive school mental health systems. Dr. Lever has over 20 years of experience providing and leading school mental health services and programming efforts at the local, state, and national levels. She serves as the executive director of the University of Maryland School Mental Health Program and co-director of the National Center for School Mental Health. She is working there at local, state, and national levels to advance research, training, policy, and practice in school behavioral health. Next slide, thank you. And behind the scenes, you won't see them today until the very end, but they will be answering all of your questions you submit in the Q&A box. We do have some good representation across our MHTTC network from our Great Lakes, New England, Mid-America, Northeast and Caribbean, Mountain Plains, and Pacific Southwest centers. Next slide, please. And at this time, I'm going to hand it over to Dr. Brandy Clark.
Thank you for that introduction, Shelby. I think what you see from this presentation today is this is a pretty big team effort to bring this content to you. This has been a unique year, and unique is putting it lightly. And I think it's reflected in the fact that we have so many of us here on this webinar today from all over the world, actually. I see some from, did I see the Philippines listed in here? Across, and all the states in between within our nation. And I think what's reflected in that is that this topic today has been on the hearts and minds of many of us as we prepare to send our kids to school, as we're opening up this school year, trying to plan and prepare for needs that we've not seen and things that we've not encountered before. To date, a lot of our time and energy has been spent on how to prepare to address the health and safety of our students. And what we wanted to dedicate some time to today was to talk about how we also prepare for the mental health and well-being of our students and our educators in the course of this year. One of the things that can be helpful when we're faced with challenges that we haven't been faced with before is to take stock of what we already know. Take stock of the things that we know that work for us, information that we have available to us as we problem solve how we're going to address challenges that we've not encountered yet before. So I'm going to invite you to do that with me. As we begin our presentation today, we're going to kind of take a walk through what are some of the things that we do know about what it is like to start our school year. What would be some of the things we would expect or would see if this were a typical year? And then how do we plan for what is yet to come or some of our new experiences? So in any given year, as we start the beginning of school, we see there's a lot of different emotions and feelings that kids might be experiencing as they embark on this new school year. And here we see a group of really excited, happy, engaged students not wearing masks. So this wouldn't be this year, but ready to engage in their school year. But we know that not everybody starts the year off feeling the same way. Some students are excited for what the year will bring. They're looking forward to learning, looking forward to seeing friends, excited about the challenges ahead of them. But some students start with a little bit more anxiety or trepidation about what the year will bring, a little bit more sadness, if you will, about ending summer, not always looking forward to that school year. So we know that the year can be variable depending on where kids are starting from. When we look at some things we know about mental health and well-being, in any given school year, we would expect that about 20% of our youth are going to experience some sort of mental health concern in any given year. So that helps us to put some perspective on what this might mean in a classroom, let's say in the size of 25 to 30 kids. We know if 20% of them are experiencing some concern, that's going to be about 1 out of 5 students in our classrooms. So maybe 5 to 6 kids per room are going to have some sort of concern that's going to get in the way of their functioning, get in the way of their ability to learn, keep friends. And that helps us to give some perspective as to what we're typically looking at. What we also see, though, is that when surveying our educators about what common things they see in their classrooms prior to this year, we also see a very high number. 87% of our teachers report that they are having students with behavior problems in their classrooms. And these concerns that they see tend to impact the management of their classroom, as well as their job satisfaction, how they feel about teaching in their classrooms. And this would be in a given year. So our behavior concerns are often a topic that we see on the hearts and minds of our teachers as they're beginning their school years. Over time, some of the things that we've also seen in the past 10 years or so is that we do have an increase in some of the rates of depression and suicide that we've seen amongst our adolescents. And this is a growing concern for a lot of us, that we are seeing higher rates of mental health concerns and that have a great impact on the health and well-being of our students. So prior to this year, this helps to give us some insight into what are the common concerns and what kinds of experiences do we see within our schools and classrooms. So with that, what we would also be planning for in a typical year is then how do we address the level of concerns that we're seeing? In many of our schools, we talk about using multi-tiered support systems. So built on strong foundations of family, school, community partnerships, professional development going into the year so that we can feel prepared to allocate our staff and resources to meet those needs. And we often refer to this pyramid model, if you will, or tiered model as a way to help us think through how that might look. Given that we think about 20% of our students are going to have some elevated need, that tells us that the majority of our students are actually going to fare pretty well. And that if we can offer some basic preventative or educational supports around social, emotional, and behavioral skill development, most of our students are going to fare well. They're going to have a successful school experience. So that also lets us know then at that tier 1 level, what kinds of supports we offer to help in that way. Maybe they're going to be less intensive. We don't need to do quite as much at this level because the needs are not as great. But for that other 20%, what we also see is about, if you break that down a little bit, maybe 15% or 15 of that 20% are going to need a little bit extra. They're going to need more support and more intervention, if you will, to be able to manage and control those needs. So we looked at then how we allocate those resources to be able to help in that way. And then knowing again about 5% or 1 or 2 students per classroom are going to need even more intensive support. So 1 to 2 students in our classrooms are going to need maybe individual supports or some higher level supports to meet those needs. And this helps us in our schools to think about how it is we allocate resources to meeting the mental health needs of our students. But we know this is not going to be a typical year, and that we're going to have to take what we know to plan for what we're experiencing now in the light of a pandemic like COVID-19. So how is COVID-19 impacting our school year? Well, one, it's creating a lot of changes for us, changes in our routine, a lack of structure that we're used to, and the way that we would typically experience our education. There's a lot of unpredictability right now, and I think we're experiencing that and seeing that day to day, that we're having to adjust pretty rapidly to stuff that wasn't known to us yesterday and becoming known to us today. We're making a lot of very quick adjustments. And that's making planning somewhat difficult for our schools and for our communities. We're also seeing really big financial issues and concerns related to shutdowns, related to some of our lack of growth. And that's impacting our schools in a pretty big way. It's impacting our communities in a pretty big way. It's also impacting our households. And so these financial concerns create a lot of stress within our schools and our communities. Some other things that we're seeing is decreased engagement in our valued activities, meaning they're just not accessible to us anymore. For those of us who engage in a lot of sporting events or social events or community events, those have been restricted. So we have a lack of access to some of the things that we used to do that would bring us pleasure or joy or that we highly valued. We also are having some constraints with social connectedness. We're not able to see family members in the way that we used to, connect with friends and neighbors the way that we used to. And that's taken a toll because that's continued to be ongoing. it's continued for months now, and so that social connectedness has been quite an issue. And last but certainly not least, we're experiencing higher levels of grief and loss. Certainly in the cases where we've had increases in death, but also loss of experiences, loss of, again, some of those relationships. And so our communities at large are experiencing high levels of grief. What we also know, though, is with all of these changes is that they're highly variable and that not everybody's experiencing them in the same way. And we've seen that on news, in our schools, in our communities, that the impact is not the same for everybody. When we think about what this means for our students, we recognize too that what is happening within our households is we're seeing higher levels of parenting stress than we've ever seen before. So in a recent study conducted by the American Psychological Association, we're seeing that parents are reporting significantly higher levels of stress related to COVID than are non-parents. And a lot of this is due to distance learning as a source of stress. Parents are taking on some roles or having some things that they need to do that they've not been asked to do before. And it creates challenges in the way that they support their children and their students. We're also seeing a lot of increased stress related to meeting basic needs, healthcare services, financial concerns, but also things like missing major milestones, students who miss their graduation, students who miss their birthday parties, families who've missed vacations or reunions or anniversaries. There's a lot of missed events that have been major milestones in the lives of families that again are part of that loss. But as mentioned before, again, we're seeing that there's a lot of disparity in the way that these things are experienced. And in many of our communities, for our families of color, they're experiencing more stress related to COVID-19 than others. And this has an impact then in terms of how COVID is experienced. Next slide, please. The reason that this is really important for us to consider, especially as we think about like our students in our schools, is that there are a lot of protective familial factors that help support the mental health of our students. And those are being tested to their limits right now. The relationships that families have are being strained. Being able to manage and control routines and expectations, create predictability, all of this is also being tried and tested within our homes, which creates more stress within the lives of our students. Next slide, please. So we talked about what we might think about the experiences of a typical year and how our students would be faring, but COVID-19 is having a big impact on that and for our communities as a whole. And some of the things that we are seeing in terms of the impact on our children's mental health is one, increased anxiety. And a lot of this comes with the experiences of having, losing some of our predictability, some of our sense of security. So we're seeing higher rates of anxiety for many of our children and youth. We're also seeing higher levels of tantrums, meltdowns, difficulty self-regulating. Our students are experiencing big emotions and stressors that they've not had to manage before. And it plays out in ways like this, where our younger kids, we may see that they're melting down more often. In our older students, this may look more like irritability, being more argumentative, or just more emotional, more tearful than we might have expected them to be in the past. Also seeing higher rates of depression, especially as these issues continue to persist. These experiences, these restrictions on activities, these restrictions on social connectedness, more isolation, we see these rates of depression increase over time, which isn't surprising for us. We're also then seeing higher rates of suicidal thoughts and behaviors, which is concerning given that we were already seeing some rates in depression and suicide before. In addition to some of these things, we're seeing that inattention and difficulty engaging or learning difficulties are increased during this time. All of these experiences that we just talked about, anxiety, depression, difficulties with self-regulation, impact learning. They impact a student's ability to attend to learning, to take in information, and if they had difficulties before, changes in their routine, changes in learning modality are going to make that even more challenging for our students. Some recent research that's been conducted is kind of also helping us to better understand, well, what does this look like? So a nationally representative survey of about 3,300 young people between 13 and 19 years old. They rated that approximately 25% of them are feeling disconnected from their peers and adults. So again, that relates to that social isolation and disconnectedness that we talked about. But over half of them are experiencing more worry about physical conditions, emotional health, finances, stuff that we would hope our kids wouldn't have to be thinking about. More and more of them are. And the way that that's playing out is we're seeing that it's impacting their health and well-being. They're losing sleep because of the worries and the things that they have. And we know that when our kids aren't sleeping, that has a big impact on their overall well-being. You can click that one more time. Thank you. Our research from past pandemics and other natural disasters tells us that what we're experiencing now is pretty common to these types of situations, that we do see that these experiences are what we've experienced in the past. Our history tells us that depression, anxiety, stigma, shaming are things that we've seen with other pandemics historically. We also see that those longitudinal and negative impacts from natural disasters, they don't go away quickly. Some of them stick around for a while, and we understand that because these things don't simply go away when our health improves, that some of these things have lasting impacts on our finances, lasting impacts on our sense of security. So putting this into context, we're now seeing that what we're thinking through is that our students are going to be experiencing higher levels of needs in this coming year. Their mental health is going to be greatly impacted by the situation that they're experiencing. And what does this mean for us in terms of thinking about our needs and our resources and how to plan for those? Unfortunately, one of the things that we also experience here within the United States is that most of our counties across our nation are considered mental health professional shortage areas. And you can find your location here on the map. If you live in a gray area, lucky you. You have a higher ratio of mental health providers within your communities. Those listed in any shade of blue, though, reflect that we do not have as many mental health providers as needed to meet the needs in our population. This is not a reflection, though, of even those trained to work with children or adolescents, simply our mental health professionals in general. So this makes the resources and accessibility of school mental health programming in our schools ever more important. And we've seen this historically in the past, that schools are the primary mental health resource or service provider for many of our children. So for those who do receive services, 60 to 80% of those are usually doing so within their schools. And in any given year, 20% of students would be receiving mental health services annually. So again, having access to school mental health programming is pretty important in a typical year. Some things that we also know about access to those resources is that it does some pretty important things for us. One, when our students have access to these services, we also see that their academic performance improves. We can kind of understand why when we talk back to the impacts that some of those social emotional issues might have on learning and engagement. We also see that when we offer this programming within our schools, the climate improves, general safety improves, and we decrease bullying. But perhaps one of the things I think is most telling too about this is that having access to school-based services, our students are 6 times more likely to complete treatment because it's easily accessible to them. When they have to leave school or leave services to access it outside of that, it becomes more challenging. So that information is important for us to consider as we're thinking about, well, what resources are we offering at this time? When we talk about comprehensive school mental health systems, it's important for us to know, though, what we mean by that. We're not saying that schools need to be all things for all kids and families at all times. When we talk about comprehensive supports, we talk about that full array. Again, think back to our pyramid, tiers 1 to tier 3, supports for all students. That's built on a strong foundation of your school professionals, but also partnerships with our students, with our families, and our community partners. So those partnerships actually become ever more important when we talk about the context that we're in right now. Our school mental health systems also not only address the needs of our students per se, but also the social and environmental factors that impact their health and well-being, which we're seeing is ever more important now in this context, that we're able to address those things that impact student mental health. So what do we need to consider as we think about how we're going to address student mental health amid COVID-19? I'm going to address a few points here, and then we're going to come back to this as well at the end of our presentation today. But a few important things. One, we need to assess the infrastructure we have for universal screening. As we mentioned before, we're going to have a lot greater needs this year and more students presenting with needs that maybe hadn't had them in the past. But in order to screen for that, we have to have the infrastructure to be able to support it. And so that first and foremost has to be one of the things we look at is within our schools and districts, what workforce do we have, what partnerships do we have to be able to do the screening needed to meet needs within our schools. Thinking about our multi-tiered supports, again, they're going to be as increasingly as important as they've ever been, but we may see some fluctuation then in terms of the resource needed. We might have more students than we've had in the past that meet the level of our tier 2 or tier 3 services. We might need to adjust the supports offered at tier 1 because more of our students are experiencing these challenges together. So our tier 1 services may need to be more intensive. We also need to plan for a triage process. How are we going to identify those students with immediate needs or concerns? And who are we going to access to be able to support those? Again, thinking about those partnerships needed to be able to meet those needs if they increase. Preparing for grief and loss. Some of our communities have been impacted by this more than others, and being able to prepare for what that means. I will make mention that we do have a Grief Institute coming up through the MHTTC. So if you're looking for some resources on that, we will be providing some training related to this particular topic. Establishing and sustaining a method for telehealth. We've learned pretty quickly that that's an important part of providing mental health services in the last few months. So thinking about the ways that can be offered and sustained over time are going to be important in this year more than ever. Thinking short-term and long-term, as we reopen and as we recover, what is going to be our immediate and our long-term response, because we're going to have these needs, as we talked about, they're going to be longitudinal. They're not going to go away anytime soon, and we need to have a plan that prepares for all of those phases. Expecting variability is also important. Our communities are not being impacted in all the same way, and that in and of itself means that we need to be able to plan and offer a multifaceted approach that's going to be able to help meet those needs. No one-size-fits-all approach is going to be able to do this. And our schools, our districts, our communities are all going to look just a little bit different. We offer here some screening tools and questions that you might consider using as part of that screening process in this year to get at some of these issues that might be impacting your students and your families in a way that's different from what you may have been screening for in the past. So we offer a list of some potential questions to consider as you think about that screening process. Things about family difficulties, loss, housing, housing and trouble with accessing food or food insecurity. Also asking questions about thinking through planning for in-person, hybrid, or distance learning. What are the needs associated with that? But also what resources or supports are students going to need to support it? Next slide, please. As you're preparing for crisis planning, as we talked about too, some other things that, examples for things to be thinking about and ways that you might plan for what those partnerships are going to need to look like within your community. So we offer here just some checklist items for things to be thinking about for how you're accessing your crisis supports as part of your triage process. Things like access to hotlines and your crisis, your community resources. The one thing that I like to highlight here is peer support. This is one time when thinking about how you're engaging your families and your students as a part of your resources is going to be really important. And peers can be an excellent way to engage other students. Next slide, please. So to put it in perspective, there's a lot to think about in this coming year and a lot to plan for. When thinking about what things rise to the top, student health and safety is one of the first things to plan for. Yet when it comes to mental health and well-being, those crisis points that need to be considered obviously are the suicide prevention and postvention and how to respond to loss. In particular, how to respond to death within your family or your community. So those, making sure that there's a crisis plan for those issues is most critical as you're thinking about what to include. For specific resources, we've got a lot listed within this presentation today and on the MHTTC and National School Mental Health websites. We're just gonna highlight a few for you today because if you're like all the rest of us, we have a lot of information overload these days. So one tool that may be useful or helpful as you are doing your school reentry is a tool put together by the National Association of School Psychologists on school reentry considerations. But one of the things that we also know is it's not just our students that are being impacted by COVID-19. Our educators are being impacted as well, and they're a big part of this system. So at this point, I'm going to turn our conversation over to Dr. Nancy Lieber, who's going to talk about how we support our educators during this time as well.
Thank you, Brandy. Hi, everyone. I'm Nancy Lieber. I co-direct the National Center for School Mental Health at the University of Maryland School of Medicine. Our center is funded by the Health Resources and Service Administration to lead the National Quality Initiative, which is focused on working with states and districts to improve the quality and sustainability of comprehensive school mental health systems. We really focus on advancing school mental health, research, training, policy, and practice at the local, state, and national level, and have as our mission to strengthen the policies and programs in school mental health to improve learning and promote success for America's youth. You know, we are working on a shared family, school, community mental health agenda. The schools cannot do this alone, and really it will take a village to help all of our students. Through our National Center, we have a wealth of resources available on our website. Our website is www.schoolmentalhealth.org. As a national center with federal and state funding, all the resources that we have are made available to you, to the public, at no cost. So if you have a budget of $0, it's nice to have access to a lot of resources right at your fingertips. And one of the things that we've done in the last 6 months is we specifically have added 2 tabs to our website, one specifically addressing COVID-19 and the other one on cultural responsiveness and equity. We have a wealth of resources there, and we continue to update that as we move forward. You know, Brandy shared that our multi-tiered system of support, and you know, we the wonderful part of this is that we have a foundation for doing this work, but we need to also consider, what are the modifications, what are the adaptations that we need to think about during COVID-19, but also as our nation has been addressing some implicit bias, structural racism. How do we work with this multi-tiered system, with this public mental health system strategy within our schools to figure out how do we deal with the context that we're in right now? Now, one of the things that, as the word we tend to use, it's unprecedented times. It's easy to get anxious, and, as an adult, as our teachers, as school staff, our mental health providers, our emergency responders, it can be easy to become overwhelmed. But I think it's important to look to this quote from SAMHSA, the National Guideline for Behavioral Health Crisis Care, the Best Practice Toolkit. And the quote is, perhaps the most potent element of all in all effective crisis service systems is relationships. To be human, to be compassionate. We know from experience that immediate access to help, hope, and healing saves lives. And I think it's really important to go back to our foundations. This quote really reminds us that key to all the supports and services and in helping students and families during times of stress is relationships. The relationships they have with positive adults very much matter. And, being kind, offering help, hope, and healing, makes a difference. Even if you do not have all the answers, or we don't know all the best practices for this new reality, starting with the relationships can really help students to manage their stress. Not only can they manage their stress, but they can continue to thrive. There are so many things that we lose touch with, during a crisis. And it's really important to remember that in the work that we've done in school mental health, we have very strong foundations, core principles and practices that are evidence-based that we can hold on to during this time of uncertainty. And, in the work that we do with the school mental health, community mental health, public mental health, we have our best practices and strategies. That is our always. What do we always do? And what we need to do now is think about how do we keep some of those fundamentals and layer onto that? What do we do to continue what we need to do, but to do that in the context of COVID-19, structural racism? So just to remind you about what some of those core features in school mental health, and Dr. Clark touched on some of these. We have some amazing educators, student instructional support personnel. We need to make sure that they need to be adequately staffed. They need to have their training to address student mental health. And this workforce is working together with our youth and families, our community mental health systems, our emergency responders, public health, the larger group, to create a fuller continuum of care for all students. We need to come up with strategies at all levels of that multi-tiered system of support and make sure that what we come up with, that it's evidence informed, that we're being sensitive to cultural responsiveness and equity, and that we don't lose sight of, even during this time of stress, we want to be making sure that we're collecting data. Is what we're doing working? And if not, what can we do to modify some of these systems? So I just want to start by reminding people, we have a lot of knowledge for many years of doing great work in behavioral health. And I think it's important that we continue to turn back to that and remember some of those best practices. This slide here, one of the things I want to do now is think about probably one of our most important groups to consider when it comes to mental health in schools and identifying students with mental health concerns. Our teachers are critical as part of our mental health continuum. They are often the first to identify problems in students and to begin to help students to get the supports that they need. But we've heard so far about what our students are experiencing, what our parents are experiencing, I want to slow down for a moment and talk about what are our educators experiencing. And this slide captures the magnitude of some of the stressors and concerns that were shared by registrants for recent webinars for the Center for Great Teachers and Leaders. As they registered for the webinar, participants responded to the question, what stressors are you and your colleagues currently experiencing as you prepare to reopen schools this fall? And this includes the responses from teachers. The bigger the words are, the more often these responses came up. They're worried about their needs, meeting the needs of struggling students, missing students, feeling helpless, having unresponsive students, unable to reach students, worried about inequities, wondering that some students are safer at school. What can we do? That teachers have a lot of stress that they experience in general, but these are new stressors that are being layered on. Not only are our teachers stressed, but our school leaders are also experiencing. So our school administrators were also asked, what stressors are they experiencing as they prepare to reopen schools? And you can see, again, from just the words that pop out, that sense of uncertainty, unpredictability, fear, shifting priority, constantly shifting landscape, a learning loss, how to teach our youngest children, equity, access. We are seeing that people are expressing concern over student mental health, learning losses, health, and well-being during this time. And on top of this, they're worried about financial considerations, that their schools will have the necessary resources to support all students. In a survey of teachers in New Orleans that was done in June, as part of the New Orleans Trauma-Informed Schools Learning Collaborative led by Beth Cooney, they asked them teachers about the most difficult aspect of teaching during the pandemic. And the responses of what they were most concerned about in descending order was the lack of connection. Online teaching challenges. Many of our teachers have not trained to teach online. Lack of student or family resources. The negative impact on work, on family and self. Increased job demands. Tension between academic expectations and student well-being. Feelings of inadequacy, worrying about student basic needs, and equity issues. Our teachers certainly have a lot on their minds related to students this year. Beyond the reading, writing, and arithmetic, we know from a publication from Child Trends about supporting children's emotional well-being that we really need to be focused not only on the academics, but also encouraging reassurance, routines, and regulations. One of the things to think about, when you take an airplane, one of the things they say as you're getting ready to prepare for the flight and they're sharing the safety considerations is, if the oxygen mask drops down, put your own mask on first and then help the person next to you. For our teachers to be able to help students, our school staff, our administrators, first we have to make sure that we're taking care of them, that their own well-being is addressed so that they'll have the resources needed to help the students around them. We know that teachers functioning, how their level of stress impacts the students in the classroom. Teachers who are stressed demonstrate greater negative interactions with their students. They're more sarcastic. They respond more negatively. They're irritable. And in a study of 400 children, they assessed cortisol levels. And what they found is when teachers reported higher levels of burnout, students in their class were actually showing physical signs, higher levels of cortisol when in classes with teachers who were more burnt out. So, teachers have a tremendous impact on students in both positive and negative ways. Now, yoga is wonderful. I like yoga as well, but we need to do more. And teachers have said, as we're presenting wellness presentation, please don't tell me to just do more yoga. Yoga is wonderful, but what else can we do? What can we offer for teachers beyond yoga? There are elements of the school environment and structure that can cause considerable stress for teachers, including like the large class size, pressures related to testing, inadequate resources, high responsibility for others, behavioral challenges. The mechanisms commonly suggested to reduce teacher stress tend to focus on the teacher's responsibility for self-care versus the school environment, the structure, the larger system, the organizational factors. It's very important to include in wellness self-care practices such as meditation, exercise, participation in a support group. These are great strategies, but these strategies alone are not going to get to the root causes of teacher stress. And what we want to make sure that we have a more holistic approach for helping our teachers' wellness. So promoting teachers' wellness requires attention to physical and mental health, professional development and support and resources needed, and organizational change to help teachers to be able to function at their optimal level in the classroom. And we know that any profession is bound to have its stresses, and teaching's no different, and there's going to be more stresses during this during the time of COVID. But we want to make sure that the burden of stress reduction is not placed on the individual teacher, and that we have a strategy to improve overall school wellness. And we can better shape healthy schools for teachers and students by addressing the underlying causes of chronic stress and cultivating environments that promote the teacher wellness. And if we can do this and we focus our attention to healthier, more supportive school environments, we will see not only teachers who have greater levels of well-being, but also students. So the more we focus on helping our teachers, the more we're helping our students as well. Mental health literacy, making the understanding of how to obtain and maintain good mental health is very important for our educators. Mental health is a part of our classrooms, and it's important to understand and identify mental health disorders and their treatments, be able to recognize and address stigma in the classroom, and to help students know and educators know how to get help when they need it. Where do they go? When do they go? What should they expect? The curriculum, the mental health and high school curriculum guide that's shown here, is a widely adopted mental health literacy program. It's available on teenmentalhealth.org, and it was developed in collaboration with the Canadian Mental Health Association, and it aims to help teachers to be familiar and comfortable with their understanding of mental health and mental health disorders, and to really share this information with students. And they're able to deliver the information, the content in the classrooms. And one thing I really like about it is that it includes obtaining and maintaining positive mental health. So it's not just focusing on mental disorders and their treatments, but what can we do to maintain positive mental health, decrease stigma, and continue to seek self-help. Another resource, the MHTTC and the National Center for School Mental Health conducted an environmental scan and needs assessment of available educator mental health literacy, training, and resources. And the product developed, which is supporting student mental health resources to prepare educators, really describes, as part of it, describes the role of educators in supporting student mental health, explains the core components of mental health literacy, and provides an annotated list of existing resources and trainings that instruct educators on mental health literacy. And it uses this icon key and just to make it easy to understand, so you can see what the cost is, the modality, how it's offered, what grade level it targets, whether continuing education is available, and what mental health literacy components are addressed. And this, you can just see an example of some of the programs that were included in this. The Mental Health Technology Transfer Center Network, which we've said is funded by SAMHSA in partnership with the National Center for School Mental Health, is working currently to finalize a free, practical, and engaging online course and website focused on educator mental health literacy. We are incredibly excited about launching this course. It's referred to as Classroom Wise, Wellbeing Information and Strategies for Educators. It's a mental health literacy course for teachers and school-based staff. It will focus on promoting the mental health and well-being of students, as well as understanding and supporting students experiencing adversity and distress. And we will also consider, there will be some additional modules in collaboration with the Central East MHTTC, which will focus on cultural responsiveness and equity in the classroom. One thing we need to consider is this, when we're thinking about how we can best help students, is this a normal reaction to COVID, or is it something more? And during this time of increased stress, we're anticipating that we will see more depression, more anxiety, but that doesn't mean that everyone will need the highest level of treatment. We need to think about our tier 1, our tier 2 supports. Maybe we'll see more tier 2 supports. What can we do for people who are at risk? But we want to make sure that we have more strategies and that we have a sense of understanding, when are these typical and when is it something that we need to have more concerns. And this is something our educators need to be aware of, as well as our parents. And this is, one thing that having helpful handouts can be important for how are you going to communicate what are the warning signs of depression, so that our youth, our families, our school staff are aware of when they should be concerned. One of the things we've been talking about is, in order to do that full continuum of care across that multi-tiered system of support, it's really important that we're teaming, that we're working together. We need to have multidisciplinary teams, and these are some of the best practices associated with teaming. And we want to make sure that we don't lose sight of these important factors, including, having multidisciplinary teams, making sure our youth and families and our community partners are part of these teams and are part of the provision of services to all students, the planning, and everything from planning to implementation to evaluation should involve our youth, our school family community partnerships. We need to make sure we're addressing the full continuum, that we're doing this in an efficient way, that we can avoid duplication, that we've delineated roles and responsibilities. And most important, we need to have effective referral processes, and we need to think about what those are going to look like now. And again, how do we make sure we're using data to make the decisions and to plan what we're planning, but also to share data and make sure that our different groups that are working together are sharing the impact and the challenges and successes that we're seeing in the work that we're doing with students. Some adaptations to consider as we're doing this work with our students and families are, how do we make sure that our families are very much included? Should we be reaching out to invite family organizations? How do we engage youth and families so that they're able to still provide a voice when we're not in person? What meeting strategies can we consider? What is our best way to get the opinions and perspectives and not just have one youth or one family member providing their ideas and thoughts? Also, we need to think about equity. Are we sure that the youth and families that we're partnering with, do they represent the full population that we're serving? And if they don't, how do we broaden the groups that we're working with to make sure we're getting their input on how to best serve, their family, their community, so their youth can be successful? Other considerations for when we're partnering with communities partners or our school community partnerships, how will the referral process work in a virtual or hybrid environment? Often some of our referral processes were, a paper and pencil and putting it in the mailbox. So how do we make sure that we have new systems, whether it's virtual or a hybrid or even in person, because things could change? How do we make sure that we have systems about how to triage, how to share data? If there's new roles and responsibilities, how do we outline that? And how do we best communicate between our school and community partners, because we can't do this work alone. But to do the work and not communicate with one another is not going to work. There has to be communication and collaboration to help all students to be successful. And this is a resource that provides from our National Center for School Mental Health, which gives a lot more information about best practices in teaming. And with that, I'm going to turn things over to Brandy, who's going to quickly share some resources.
Just wanted to highlight a few things that are available to you through our MHTTC network. We do have a landing page on responding to COVID-19 school mental health, so a resource for you to see about all the things that we have listed and events that we have and free trainings available to you. We also, if you can go to the next slide, have a landing page specifically on telehealth. So I know that was a series, we've done a lot of work in this area, put together a lot of products, webinars, and trainings, because it's something that a lot of us have had to shift to pretty quickly. So if you're looking for information on telehealth, there's a landing page for that as well as how to address mental health disparities. So if you're looking for any of those resources, you can access them through the network there. We also listed a few other trusted resources that you can access for further information, as well as links for psychological first aid and how to do some crisis planning. At this time, I'm going to thank our panelists who've been doing an amazing job of answering questions as they come in. We have time maybe for one or two more questions, so I'm going to let Dr. Erica Franta, if you can join us here and let us know what questions do you have for us.
Wonderful. Well, thank you so much, Dr. Clark and Dr. Lever, for sharing all this great information about how COVID-19 has been really impacting our students, our educators, and our families, and really laying the groundwork of maybe some next steps that we can all be taking. I would just also want to thank our participants. We got a lot of really, really great questions in the Q&A and in the chat. And again, another shout out to our panelists for being able to address those throughout the webinar. I do want to let everybody know that we will be able to put these questions together into a Q&A, an FAQ type of document to send out with those slides. And we can address those then at another time. But one question for Dr. Clark and Dr. Lever, we got a number of questions about really families, and I love how this latest person posed it. If our agencies and organizations could give families one thing, whether it's a resource or a handout on the first day of school when they come back, what would you recommend would be included in that? Or do you have a resource that they could use? Either of you two.
Okay.
Nancy, I'll let you start.
Sure. We definitely have some resources on our school mental health website, but I think at this point, how do you develop new rituals, routines, and strategies, and also being kind to themselves? It's not going to look perfect, and maybe being realistic about what you can do and coming up with new strategies and routines that can help all families.
I think, and along with those lines, we've often talked about the 3 R's. Yeah. So when it comes to engaging with our families, and I think we have some pages listed on this, but those 3 R's being relationships, regulation, and routine. So reminding our families that the relationships they have with their children, engaging in pleasant activities together, is one of the most important things that they can do outside of school to help our students with stress and anxiety that they might be feeling, helping them with regulation of their emotions and their behavior, whether that be deep breathing techniques that they practice together, getting good sleep that they can practice regulating. And the last one is establishing routines. The more they can create predictability in those routines, the more it helps our students to learn how to regulate.
And if I can just add
those 3 R's.
And if I can just add that parents should be willing to ask for help and to know that there's a lot of help in schools, in the community. It's going to be hard to do some of this, especially when parents are multitasking and some of them are working, some of them are managing multiple children. There's a range of needs that the parents have that it's okay to, it will take a village. It's okay to ask for the help.
Well, thank you both so much. And thank you everyone for attending today. Again, if you want any more information, Ricky is posting right now the website for this webinar as well as our network website. We have a lot of free resources on the MHTTC network website. You can also get connected directly with the National Center for School Mental Health website from that platform as well. Again, we will be sending out the slides to everybody who attended today and registered. And thank you all so much for being here today.